Thank you all for joining us today. I'm Erica Reynolds, and Julie Zielinski and I are going to be talking a little bit today about camps for children with chronic illness. We love camp. I've been volunteering at diabetes camps probably almost every year for the last 15 years. It's one of my favorite weeks of the whole year, even though it's one of the most exhausting. So we're really excited to be able to talk to you about camp today. Our diabetes camp has had to take 2 summers off because of COVID, and we're really excited to be getting to have camp again this year and to share a little bit about camp with you guys. So why are we talking about this topic? So hopefully a lot of you all had the opportunity when you were younger to attend a summer camp and have great experiences there. And know how important summer camp is for kids. So many of our kids who have chronic illnesses are not able to participate in some of those traditional summer camps. There are some camps that are not able to even offer that camp experience because they can't properly attend to those kids' medical needs in a way that is safe. And even if those camps are willing to take some of these kids, some of the parents are just terrified to send their child to camp. For example, if your child has diabetes, if they have hypoglycemia, severe low blood sugar in the night, if someone doesn't attend to them and address that quickly, then they can have a seizure or could potentially even die in the middle of the night at camp. So, these families are just too afraid to send their kids to camp. Some of the patients themselves, our kids, may be also afraid for some of these same reasons. And then sometimes they might just be maybe feeling too self-conscious or too embarrassed to go to a traditional medical camp with all of their medical needs. When you're particularly if you're at an overnight camp, you are 24/7 with other people. So no secrets when you're in a room sleeping with 12 other kids. For example, our kids with diabetes, they're having to check their blood sugar and take insulin, 6 to 8 times a day. They're having to sit out from activities because they have low blood sugar. These are things that are, disruptive and really obvious to other campers. I'll tell you, one year at Camp Too Sweet, we had a child that was on peritoneal dialysis, and every night when she had to get hooked up because of the infection risk, like the entire cabin had to be cleared of all the kids. They had to get out, and I think that that's something that's hard for kids to have to deal with when they're in a typical camp with kids who don't have to deal with those same issues. And I think these camps also have special benefits for our patients, beyond the typical summer camp benefits that all of our healthy kids get. So some of our patients really never get to meet other patients that have the same medical condition that they have. So for example, I have patients that have diabetes, and they might be the only child at their school that have diabetes. So they've never really gotten to meet someone that has to deal with the same things that they have to deal with day in and day out. And it can be really nice for them to have a week where everyone is doing the same thing and they're normal. Also, it kind of helps kids maybe see new treatment options, and especially with diabetes, new technology options that they maybe didn't know about or were maybe kind of anxious and fearful about trying. So for example, maybe they were not sure if they wanted to wear a continuous glucose monitor or an insulin pump, and then they see other kids wearing it at camp and really kind of see like how it is to use those devices and might be willing to try it. They may also see kids who just are positive role models for them, older kids who are, living life with their same condition and doing well with it. Even just little things. So oftentimes we'll have kids at camp who maybe are just willing to try their insulin pump site in a new location, like their hip instead of their arm, because they can see other people doing it and they have that really kind of positive encouragement from the other campers. And it also really shows kids that they can take care of their medical condition in new and sometimes difficult situations, when they're hot and sleep deprived and tired and doing all kinds of new activities that their diabetes or whatever they have does not need to slow them down. So it can really give the kids self-confidence to be more independent with their disease management and maybe feel more comfortable kind of trying new things. So, I I think camp is wonderful, but there's also some good evidence to support the benefits of camp for kids. So there's tons of research studies out there where people have maybe looked at one specific camp for one specific chronic illness and demonstrated positive benefits of that. I just pulled this one study because it was a nice systematic review of 21 different studies where they looked at a variety of different chronic illnesses and camp participation, and they showed short-term, at least short-term psychosocial benefits on things like social outcomes and like social interaction and acceptance of your condition and disease burden. This was another study that I wanted to share with you guys again, because I think it was a larger study. So they looked at 44 different diabetes camps across the country, and they had almost 2,000 parents and almost 2,000 kids and adolescents. And they did multiple surveys looking at problem areas in diabetes, self-care skills, and diabetes resilience. And what they showed was a decrease in diabetes related to stress and an increase in perceived independence in diabetes self-care skills. And this was reported by both the parents and by the campers themselves. And there was good correlation between reduced distress and increased independence from the parents and what the children or adolescents felt. So a lot of potential benefits here. So I want to give a quick plug for our Carilion Camp 2 Suite specifically. So our camp, we typically have about 50 or 60 campers in a typical year, and usually we take 8 to 16-year-olds. We've increased our age limit up to 17 because we haven't had camp the last 2 years. So we wanted to afford that opportunity to some of our older campers. Most of our kids have type 1 diabetes. We do have some patients that are insulin dependent, patients with type 2 diabetes. It is an overnight camp. It's Monday through Friday, and this year it's going to be that last week in June. Camp is held at Camp Bethel up in Fincastle. It's a beautiful camp, and we're really supported by the Camp Bethel staff. So all of the camp activities are run by the Camp Bethel staff, and the kids get to do all the kind of fun traditional summer camp things. So, you know, we have high ropes and low ropes in a swimming pool, archery, arts and crafts, hiking, lots of singing, body paint. The kids get to go tubing down the river, which is one of the highlights. And also Amy Kreider has really helped support the kids to be able to go and horseback ride at her farm. So it's just a super fun experience for them. And basically they get to go to camp and just kind of be normal kids and not have to worry constantly about their diabetes. So we have an army of medical staff that follow them around and carry around snacks and insulin and all the other things that they need and make sure that they get their blood sugars checked and they get insulin when they need it, and we keep them safe at camp. And really it's Carilion Diabetes Management and our CDEs have really done the bulk of kind of planning camp and making sure that the kids are safe at camp. So all of our CDEs deserve a big thanks. The Cave Spring Lions also have really helped support our camp for years. They volunteer at registration and orientation, and they also provide financial support to our camp. So we're very, very grateful for those folks. But what if you don't have diabetes and have another chronic illness? So there are tons of camps out there. So if there's a specific condition, you know, maybe just want to go out and Google and kind of see what camps are out there for some rare diseases. This is one website that I found that I thought was helpful. This is the Federation for Children with Special Needs, and they actually have a camp guide out there. It was several pages long where they have lists of different camps and different locations for different medical conditions. So that was one helpful website that I found. I wanted to highlight one other kind of regional camp. So I did my residency in Wake Forest, and so this was the camp I never got to work at, but some of the other residents did, called the Victory Junction Camp, and they have specific weeks that are dedicated to specific conditions. So you can see what some of the camps that they have are here. And then I want to turn it over to Julie Zielinski, who's going to tell you guys a little bit about Camp Holiday Trails.
Fantastic. Dr. Reynolds, thank you so much. That was wonderful. And I echo everything that was said about how camp can be beneficial. I specifically am going to talk about Camp Holiday Trails. Thank you for adding my slide that I gave you last minute. So a couple things, full disclosure, I am on the board of directors for Camp Holiday Trails. So I do have a little bit of leaning towards why I think it's a really good one. I'm also on the medical advisory committee for them. So Camp Holiday Trails, even though I am orthopedics, is more for the medically disadvantaged kids, not orthopedically. One of the big differences between the camp at Wake Forest or near there and this one is a little bit more rugged outdoors, whereas the one in North Carolina has more paved surfaces for wheelchairs and like that spina bifida group that goes there. A little bit because I do think it's nice to go to the website to actually see it. But it is your typical outdoor camp with the exception of having full-time medical staff there, just as she was talking about, for all of the diabetic testing, anybody that needs oxygen, any of the cystic fibrosis that needs treatment. They do have peritoneal dialysis as well. This is up in Charlottesville. I apologize. I should have led with that. But it really does help them to have a normal camp experience. It is mainly for the kids with medical needs. This year they have opened it up to siblings of a medical child, but not to anybody else for that. Ages are about the same, 18 to 17. And it really just provides that outdoor experience and camp experience for the kids to help them feel as normal as possible, knowing that everybody there needs some type of medical treatment and they don't feel alone or singled out. A lot of the counselors that are there were campers themselves, so the kids can then see what adults, big people, how they're actually doing with their disease as well. And then as far as what they have planned for this year, do have a couple of individual. The ones showing right here are the mixed diagnosis camps. And then here we have the specific one. So this top one is mainly with diabetics, and then they have a couple of multiple sclerosis and a few others that we're working on for specific camps. I have two reasons to show you all this, to know about this camp, to refer families, to refer those kids there. We're open for applications now. So number one is let's get the kids to know about it. Number two, we do need more counselors. So if you know anyone in the 18 to 24 range that wants to be a counselor, they're looking for counselors to work during the summer, volunteer. They do have a need right now a little bit more for male or male identifying counselors. I think they have a few of the female ones already. But the other one is I really would like, and I probably need to talk to Dr. Henschel privately about this, about getting this as a pediatric resident rotation. UVA is doing this as a rotation. I was able to get the med students here at Carilion to do some rotations there starting this summer as well. And what the UVA residents have said is that it's just such an amazing experience to be able to see the kids interacting, and when there is a crisis, how to treat them during that crisis and how to help them on their day-to-day lives. And that's been very helpful for them as future pediatricians. Again, they do have on-site docs and staff for all of the infusions, the labs, dialysis, breathing treatments, as I mentioned. The other thing that they do is pop-up camps, and I'm thinking, of talking with all y'all, to use that Southern phrase there, about getting a pop-up camp there at the Tanglewood parking lot even, where they just have a camp. They'll bring everybody in and kind of have a 1 or 2 day weekend camp that they'll provide all the things as long as we provide, the patients to participate. It's a great organization. I really echo everything she said about the importance of camp and how it can really help the kids, and not only to realize that they're okay, but also to interact with other people and not feel singled out, as I said. Sorry to use the word so much. The other thing that I wanted to mention completely separately is sports physicals. So separately from that, just a little plug, May 7th at ION, we're doing sports physicals. And if anyone, residents or attendings, want to volunteer some time, we are doing those and looking for people. So little side plug from that. As far as the camps, that's really all I had to say about Camp Holiday Trails. It really is more of a go to the website and kind of look around on it. There's a YouTube video where campers have made videos that they've put on YouTube, where some of the other counselors have, about just various things to keep kids involved all year round. Once they have that friendship connection, they can still continue to do that as the year goes on and they're not at camp. That's all I had. Anybody have questions for either of us?
Yeah, so I had just to really to wrap up, I wanted to reiterate a lot of what Julie just said, which is, you know, please encourage your patients to consider attending one of our camps or another camp that might be appropriate for them. Sometimes the kids need a little bit of encouragement. You know, they're nervous about going away. Sometimes the parents need a lot of encouragement too to let their kids go. But you know, honestly, some of our parents never get a break from their child's disease either, and it can be really nice for them to just have a week where they're not worrying about you know, their child's health and safety. They probably will be worrying about it, but maybe they could worry about it from the beach somewhere
Yes.
for a week.
And if the well kids can go to the camp with them as well, they get a free week, completely
Yes.
free week.
Yeah, which is it's so needed for parents who have kids with chronic medical illnesses. So, and yes, we want to encourage you that if you personally have the time and interest in coming to camp, that's awesome. If you can't spare the time but would like to spare a resource to volunteer supplies or financial support, all of those things are welcome. And if you please encourage other resident students or even your staff, we have nurses and other staff that come and volunteer at our camp. It is a super fun thing. We cannot make these camps happen if we don't have volunteers. It takes a lot of people, and it is just a phenomenal learning experience for both students and residents. I think until you do something like this, you don't really know what it's like to live every day with a chronic illness. I think sometimes we get a little bit, you know, we see kids when they are acutely ill with their disease or, you know, maybe at a checkup like every 6 months, and we don't realize what it is to live day in, day out with no breaks from your chronic disease. And it just makes you a lot more understanding. Well, gosh, I can see why you might have forgotten to check your blood sugar or take your medicine because, you know, life is crazy. And you get no breaks from these conditions. So it's a very fun and a great learning experience. So if any of you guys have questions about participating in camp, please let us know. And certainly if you guys have had other camps that you've worked at that you would want to share with us, and we will open it up to the group for any comments or questions that you'd like to share. Yeah, we have, and I will say we have been able to give students and residents rotation credit often for camp participation. We've had the residents will participate usually when they're on an elective rotation. And students sometimes have been able to attend as their like specialty week for their core peds rotation. Or we've had fourth year students on elective rotation come to camp for one of those weeks. Or sometimes we just have folks that are on their off time and want to come to camp because it's so much fun.